So, Paul, was there any, memorable patients of yours who kind of dramatically changed their life or?
When I look at some of my most memorable patients, I look at the youngest guy that I ever did, who was 21, and I did his uncle, his brother, and his father, because he had some genetic venous leak problem. And I saw him about 6 months later. He was from another state, but he happened to be down here on spring break, and he was at a party, and he was surrounded by girls in a pool, and I could tell he had his implant partially pumped up. And I was like, yeah, all right, brother. And he had thumbs up to that 21-year-old. And then the 95-year-old, who was a fella that flew me to Mexico City to do his implant. And he was just this wonderful little man, and he didn't look 95. He had the constitution of, like a 70-year-old.
95?
95. And I said, brother, you got to tell me. I mean, you got a wife, you got a girlfriend, what do you got? He shows me his plane, his private jet that he flew, along with the co-pilot, and 6 women in the back. And I go, I guess you got plenty of candidates, brother. So between 21 and 95, I guess those two would be the most memorable.
One of my guy was 21, like yours. Yeah, 21. And usually, my country, man comes alone. No one else, They seldom tell their wives. 80% of them never tell their spouses even. They're shy of it, They're afraid of let woman know it. But this guy was a different story. So it's like a family thing. His mother, his father, and every one of his family members came all to my, small practice. They crowded, my practice. Why? Because it's a 21 years old. Mother was feeling so guilty about it. His mother, felt so guilty about it, and she was actually offensive. Why you tell my son has a problem? Why are you telling my son has a problem? Did I made him bad? Did I give a bad birth? Did I give a bad influence? No, it's nothing like that. Nothing like that. So anyhow, this young kid has always been like a shy, not outgoing, hiding from the, peoples. After 6 months later, became a different person. So he came up not because of the implant, but because of the urethritis.
So he presented with pain in his urine.
Yes.
When I'm teaching, I bring you up a lot of times because when you look at the top implanters in the world, we're the ones that utilize certain types of studies, and the Doppler, and you can go into length at another time about this. But you're able to look at the 21-year-old and go, brother, it's not here. It's here. Yeah. And then you're able to look at his mother and say, it's nothing that you did. There's nothing wrong with your son's head. Your son has a vascular problem. And then you were able to watch a whole family change, that whole family dynamic change for sure. And that blows away my 21-year-old story because yes, they came in individually. They kept coming in. Although the guy's mother was like my age and kind of good looking, which I found very interesting. But what you did was you gave them some evidence-based medicine, and you took a family and you put them together again, which is cool. I like that story. I'm going to use it, by the way.
Do please.